diagnosed with MGUS in 2014, I started having regular blood tests. In 2019, I had smouldering myeloma, which became active myeloma after that. Late 2020, I started on the Velcade dexamethasone protocol for about 6 or 7 months, followed by a stem cell collection, my own, in May 2021, then my bone marrow transplant in July 2021. After the transplant, I felt really nervous and underconfident about what my body could do. I remember my granddaughters holding my hands, taking me on my first walk after the transplant, and I was so wobbly, and I lasted about 100 metres, and at that stage I had this lingering pain in my back, which I was convinced it was something sinister. It wasn't, but anyway, with the help of my daughter's little cavoodle, Mabel, I started longer walks and gradually started to get some of my confidence back. Then one day when I was at Icon in the waiting room, I overheard this person talking about this exercise physiologist and how good it was, and they specialise in cancer. So I followed it up and I contacted Morgan at Gaye Health, and the rest is history. Well, here's some of that history. I started with Morgan in August 2022, and I go twice weekly. I have weight training and core strength training and some interval training on the bike. Sometimes I feel pretty crappy because I'm on the chemo drug Revlimid and the side effects of chronic diarrhea, which zaps my energy. But Morgan is always willing to tailor my exercise program to suit where I'm at. Look, I'm supremely confident of Morgan's ability to care for me, and that's so important. My haematologist has always said I should do weights, and so that's included in my program with Morgan. And I still go to my oncologist because I had breast cancer, and last time I went he was very pleasantly surprised that my bone mineral density had actually improved. Look, I put this down to the weight training that I'm doing with Morgan and her team at Gaye Health. But I'm always assured that whenever I come to my training, that Morgan and her team will adjust my training to wherever I'm at, and I'm supremely confident that I'll be fine. And my tips to anyone who's got multiple myeloma is that if you can, find an exercise physiologist who specialises in cancer, because then you can be really confident that whatever you do, your body's going to be fine. And the second thing is that don't give up, just keep going, because whatever bit you're doing, it is going to help. And I know that, like, no matter how bad I feel, I come along because I know that I'm going to feel so much better after it, just for tuning up. So thank you.